Good evening, my young TV viewer. Today on your YouTube screens, we will present a solution for knee pain, the knee joint, also known in the scientific community. So friends, today we will discuss the most common locations of pain in the knee joint. If you feel pain on the inner part of the knee joint, in the area, the outer part, the front, and maybe we'll have time for the back or maybe we won't. Let's start with the inner part of the knee joint. It's the most common. The pain occurs right here in this area. Of course, if the meniscus is so damaged, the ligaments are torn, we're not talking about that. Everything swells up. There's edema. It's a sharp, acute injury. We're not concerned about that for now. We're interested in chronic pain in the knee joint, in which possibly there are some chronic injuries, maybe a little damage to the meniscus, a partial ligament tear. All of that still counts, but at the same time it hurts. For example, when you walk for a long time, after walking provokes the pain. Or after walking it hurts for a while, but there is no morning pain. There is no pain at rest. There is no significant swelling. This is all for you. Listen. If not, then this isn't for you. Turn it off. Listen carefully, those who are still here. So this is the inner surface of the knee joint. Here, pain is often associated with excessive tension in the muscles at the back of the thigh, the semitendinosus, the semimembranosus. This is the inner thigh, the adductors, and also their tendons, and there's also the sartorius muscle like this. And at the same time, the tendons of these muscles are under tension, constantly getting inflamed. The attachment site, even the periosteum there, can get a bit inflamed. And all of this starts to hurt. What causes this pain? The first test you should do now to understand whether your knee joint is to blame or if you just have abused it so much that it simply has to hurt. So look, here's the first test. Here's your knee, here's the kneecap. Let's call this the knee. Down there is the foot. And now what do you need to do? The wall, come up to the wall, stand facing the wall. Put your hands on the wall like this, as if you're being searched. Take this position. For some it's familiar, for others it's the first time, but don't be afraid of this position. There's nothing scary about it. We're just testing your knee joint. And now what do? Rest your hands, and your task is to move one leg back, just however is comfortable. The other leg is in front, with the toe pointing forward as much as possible. And your task is you stand facing forward like this. Your task now is to move your knee forward the way you normally do it and see how it moves forward like this. What options are there? Take a look. First, the knee moves inward here, relative to the big toe. That's bad. It's normal for the knee to go toward the big toe. It's normal for the knee to go toward the middle of the foot. It's acceptable for the knee to go toward the little toe. The worst position is like this, when the knee turns inward during bending. This puts excessive strain exactly on the inner part of the knee joint. If you keep moving like this throughout your life, if you go up and down stairs like this, jump, run, do high kicks with your legs, with twists, your knee won't last long. Second test. A step suddenly appeared in your way. And your task is to put your foot on this step. How do you step up onto a step? First, you shift your weight forward. And here, you also need to watch where your knee is going again. If it goes within the boundaries of your foot, just like we did a moment ago, right? That's fine. Normal. But if it goes inward, like this, and a typical person whose knee goes inward turns their foot outward like this, And it feels like their knee is kind of facing forward. Because if during this test your knee bends this way, like this, you won't be able to walk like that. You rarely see a person like that on the street. Usually the foot adjusts to this movement of the knee by turning outward, like this. And the usual way this person places their foot, including on a step, is like this. That is, the foot is turned outward, so it's more comfortable to make this inward movement of the knee. But if we now look closely at the position of the knee relative to the foot, do you see where it shifts? Very, very far inward from the big toe. Is this good? Try to answer this question in the comments. The correct answer is, it's bad. Respect to those who answered correctly. So friends, look, here's why this movement happens. What's wrong with that? The thing is, there's a certain optimal angle of joint movement at which the load is distributed evenly across all the structures of the joint. Ligaments, menisci, cartilage, anything, muscles. And there's an angle of movement where some parts get overloaded. You see, there's excessive tension on the ligaments. Right here is the tendon. So this is an injury to the joint. If this injury keeps happening, it leads to chronic joint damage, damage to certain parts of the knee joint. Here's another test. Want to try? Also, here's a situation where it might get injured. Stand up, put your feet together, turn like this. Don't do it too suddenly, so it won't be the last turn of your life. Carefully turn like this. If something cracks, it's okay. And now let's see during this turn. Let's say, let the right shoulder go back, the left shoulder goes forward. And it turns out that this knee, you see the left one, where my left shoulder went forward. And this knee too, it shifted inward. See? That's also a bad sign. If your center of gravity shifted during this turn, on one foot to the inside, on the other foot to the outside, there's nothing good about that. If during the turn your knee remains stable, then everything is fine. It's nothing to worry about. So friends, we've just discussed the causes of pain on the inner side of the knee joint. What do you want next? Do you want me to show you right away what to do so it doesn't hurt? Or something else? Other parts? Alright, let's start right away with what to do about the inner part first, and then maybe we'll get to the others later. The reasons why this happens, why the leg takes on this shape. X-shaped. The letter X. Geometry, for those who remember, there was the letter X. X, Y, like these, you see? And the legs have taken on the same shape. There you go. So it's mathematical deformation. Why does this happen? Why does the leg tend to move into this position? The thing is, you think you're controlling your movement. The brain gives the command, and the body follows out of habit. And in your imagination, you are able to perform complex coordinated movements. But the thing is, certain muscles last worked about 15 years ago during a physical education class. Since then, for example, this gluteus medius muscle has been forgotten. It's slowly atrophying. Part of its muscle tissue has been replaced by fat, part of it by connective tissue. And it stopped performing its function. What does it do? When we stand on one leg, it supports the pelvis. And when it doesn't work, our pelvis starts to drop like this. It stops being held steadily. Also, together with the gluteal muscle, it provides knee stability during movement. There should be a balance here between the muscles that move the knee joint inward, like this, and the muscles that stabilize it in this direction. Which muscles are these? The main muscles? The gluteus medius, the gluteus maximus. Which other one? For now, two are enough. Start with those. Here it is. Do you see what the knee joint looks like? What a complex anatomical structure we have. This is the kneecap. Pain in the front part of the knee is very often related to the fact that the kneecap starts to come very close, almost touching this articular surface of the femur. The distance between them becomes smaller. When does this happen? That's already painful. You see, how I switched to talking about pain in the front part of the knee. You didn't even notice, did you? This happens when the front surface of the thigh, the quadriceps muscle, becomes weak and shortened, and the kneecap loses its mobility. So, friends, let's get back to the gluteal muscles, specifically the gluteus medius muscle. The first exercise you need to do to get rid of this pain, which is related to pain on the inside of the knee right here. First, a resistance band. It's available to everyone these days. One like this, a loop band. Here it is. It's stretchable. You don't need one that's too stiff. Sit down on the chair. The elastic band. You attach it. There are two options here. You can place it above the knee or below the knee. That's already your own, how should I say, preferences. Your preferences. No one will judge you if you attach the band above or below the knee. Set yourself up in front of the dining table, or maybe for a game of chess. Cards, TV or radio, whatever you prefer. That is, it's good to do this in between other things, in between activities. While traveling, for example, in the subway, for instance. On flights, you can do all of this too. Like on the bus, 1, 2, 3, and you start doing these exercises. What happens when you do this? You get a certain load, and both the gluteus medius and gluteus maximus muscles contract at the same time. Now look, during the exercise, your foot can take 3 different positions. First, the foot just stands as it normally does, as it stands on the ground, which gives us strength. That's how it stands during the exercises. And now you stand on your toes. On your toes, lift your heels. That's it. And you make the movement like this as well. 15 to 20 repetitions depending on the band, but make sure to use a band like this so that you can do about 15 reps. Now for the third one, shift onto your heels like this. The heel is positioned like this. Touches the floor gently, and just like that. Also 15 to 20 reps, rest between them if something gets tired. If it gets tired, it means it's working. So without overloading yourself, this isn't the last time you'll do this. No need to finish everything now. To restore all of this, your task is not to restore everything at once. That was the first exercise, meaning this should be done throughout your workday. You do all of this. Second, standing up. If you're really serious about recovery, here's the standing version. Look. It's best to lean against something, maybe a wall or maybe a short friend. And like this, you move your leg to the side, but now with a straight leg. It's similar to the previous movement, but it's actually quite different, right? So here you are. For example, a colleague at work, you are together. Let's say like this. So you were taking a smoke break together, and at the same time you were doing exercises with him. That happens too. So this is again the gluteus medius muscle. Now we had a situation when you stepped onto a step like this, right? And your knee would go inward like this. What should you do about it? That's it. Again, you take your resistance band like this. Hook it up, stand on the step the same way, and do the same thing. You do this with one leg now. If you can't move it at all, if there's no range of motion, what do? You stand here a little to the side and add a bit of range of motion. So you can change the position of your leg to something a bit unusual. Not how you'd step onto a stair. We do this. Then we do the same thing on the toes. And on the heel, we do the same thing, right? Then, in a static position, stretch and hold it. With one leg, then the other. Repeat the same thing. Is it clear now? Then take off the band like this. There you go. To be continued, to be continued. What do we do next? This is for A, and this is a repeat. Now let's watch. To begin with, when you step up onto the step, if your usual position is with your knee inward, you should try to do something on purpose. Break the step up into stages. Watch, first there's one movement, then you have two movements, which is what you're used to. And instead of the second movement, you do two. This knee right here goes inward. 1, 1, 2. So first, look, 1, 1, 2, and then you do 3. Before it was just 1, 2, right? 3. And now 1, 2, 1, 2, 3. 2, 3, 4. Got it? Got it? All right, friends. Next, we have a turn. Who noticed that during the turn, their knee bent like this? Good news for you too. What should you do to keep it from bending? Look. During the turn, if we make the movement, our knee goes inward. What does this mean? It means there isn't enough mobility right here. The first exercise to keep it from turning is to make it do a different movement. One option is, if we keep it bent, again, we move it outward like this and see how it goes. Before turning, we do this movement here. Yes? You can bend the knee a little to make it easier and then turn, but you might notice that the turn isn't enough. That's why you had to move it inward. The second option is to straighten it. Straighten the knee. Tighten the muscle, and only after that turn, then it also won't be able to move inward anymore. The second option, if it's hard to coordinate your own body. We take the roller here, place this leg, bend it, come up onto your toes, put your knee against it, press it down, and start turning. Turning, turning. And here you see we turn away from the wall. If your knee goes inward, this thing will fall. This is kind of an indicator of whether you're doing the exercise correctly. Well, friends, I see grateful eyes. Teary looking at me. Someone started crying from happiness, I understand. Please don't hold back in the comments. All your admiring greetings. You can leave your wishes. Comments are currently available to everyone. For more details, if you are interested in walking, if you have decided to gain complete control of your body, there is a complete program for you at the link in the description. The Biomechanics of Movement program, How to Learn to Move Your Body While Walking and in All Other Movements, is available. Please check it out. And I wish all the best to everyone else. See you next time.